So just prior to that, I'll give you context about the project itself, which is called Récit du don et de la vie en contexte de soins par l'organon, which is the organism behind. And I'll present you a short summary of that paper Mariam was talking about. A short summary of the results that we published last year about it. And then I won't take too much time, and then I'll pass the baton to Paul and André, and then we'll open up to questions after that. So hope that's a good plan. So we are the McConnell Chair. So that's the bigger organization behind the creative writing workshop. So it's a research chair in research creation, so in literature originally. So the creative writing workshops that we did were part of that larger chair. So the goal there was to really be transdisciplinary and join medicine and literature together to promote this kind of innovative way of conducting research for the benefits of patients, healthcare professionals, also literature scholars and students, and the general public as well. So there were many different arms or sub-projects, we could say, to it, and they were mostly consisting, for example, of different creative writing workshops for different target populations, if you will. So healthcare professionals, literature students. So there was, for example, a summer university program, which was done for 2 years, and also patients. So in our context, transplant patients, but not just kidney. Today we'll talk about the kidney project, but there were also an extension of that to heart, liver, and lung transplant patients. So the academic side of the project consisted into like conferences, events for medical humanities and researchers. And the general public arm consisted of the creation of a website, which I'll show you in a minute, which showcases the works of the participants, which of course consented to share their work. So it was created in 2019 by 3 people: Dr. Fortin, a nephrologist at the CHUM, and a clinician scientist working a lot in qualitative research and with patient partners. So Simon and Catherine, which are literature professors, scholars, and writers themselves. And the 3 of them really believed that writing can make us all meet in the middle, that despite our different disciplines, we can all talk and exchange our different types of knowledge or ways of knowing about illnesses and health. And that above all, it can all do us some good. Our literature in that way is seen as a form of care. So specifically, the project called Récit du don et de la vie en contexte de soins aimed to deliver creative writing workshops for kidney transplant recipients, candidates, and donors. So there were 3 types of participants all mixed in together in the same group. So which André and Paul took part in, respectively, so as a kidney donor and a transplant recipient. So it's the first kind of project of this kind, we can say, for the population of kidney transplant recipients, donors, and candidates. So a little bit more about the creative writing workshops themselves. So there were in total between 2020 and 2022, 4 cycles of each 2 to 4 creative writing workshops. So they all aimed using different narrative genres and forms to explore how we tell a story about the experience of transplant or donation. So the aim was also to create a sense of community around these experiences, which I hope was largely a success. But I think we can say, just from the presence today of Paul and André still to this day with us, that it's a testimony to that. Some workshops were on screenwriting, graphic writing, so you can see an example of that on the screen. So a work from Paul himself. Some were on dream exploration, sound creations, poetry, etc. And they all invited participants to explore an aspect of their kidney transplant journey with a specific prompt. So those workshops were led by authors and writers, so non-clinicians, non-therapists. And each group comprised of about 10 participants, and they were held on Zoom. This was during the pandemic, so on evenings for about an hour and a half. And finally, after the creation of the work itself, there was an editing process which was offered to the participants. So from the chair members, which, is suggested to accompany
There's
those.
no output. Open volume.
So they basically accompanied the participants to publish their work on the website after. So here's a snapshot of the website itself. I wasn't able, unfortunately, to make it move. I would have liked to like show you how you can scroll the web page and see all of the participants' work and a short bio for each of them. The website is quite pretty, so but you can go see for yourself. There's actually another research project going on at the moment to evaluate the impact of such a platform for its readers. So we can see who it reaches, what are their reactions and their level of engagement with the platform. And we published this qualitative paper in the Canadian Journal of Kidney Health and Disease on the impact of creative writing workshops on kidney transplant recipients, candidates, and donors. So we did a qualitative analysis of the themes which emerge from both focus groups and individual semi-structured interviews that we conducted with the participants. So before the workshop on the left and after the workshop on the right. So this is what the figure here summarizes. Before the workshop, participants initially identified what we call significant moments in their donation or transplantation journey, which were highly emotional, and associated with a lot of uncertainty. As shown by other scholars before, the transplant experience doesn't necessarily correspond to the medical temporality, where the procedure is sort of described in this dominant narrative as a healing moment. On the other hand, actually, transplantation is characterized by a non-linear temporality, and I'm going to quote here Wasson paper. As a post-transplant time is still profoundly structured by waiting, expectation, and suspense, the transformed body less healed than permanently contingent and fragile in different ways. So, as our participants reported, the experience is also perceived as lonely, and we can assume that the high intensity, uncertainty, and loneliness of the lived experience of transplantation or donation lead to the search for experiential learning and support from self-narratives of peers. So a number of reflective processes were thematically identified. Then in the middle, I don't know if you can see my arrow, from our participants' responses, which occurred during the workshop. So including learning, relativization. So this means putting into perspective their situation vis-a-vis others. Normalization or validation of their own situation or lived experience, and a newly found appreciation of their experience, which also involves this kind of putting into perspective of their experience. So even though the creative writing workshops were described as emotionally demanding at times and time-consuming as well, they were reported by some participants as being therapeutic. And this is the million-dollar question as to what it means to be therapeutic. The meaning of that term is still largely undefined, at least for the purposes of this kind of creative writing workshops for our population. Because it's reported sort of very variably in the literature, for example, as a source of personal growth, emotional release, something that can increase well-being and self-efficacy, in expressive writing, for example, in psychiatry, or dignity therapy in palliative care. But it's kind of hard to really understand what does what, and what part of the creative writing workshop is accountable to do what kind of consequence for the participants. On the bottom right, there's also some elements that were reported by the participants, as a way to give back to others. So either by helping out other patients, for example, this sense of being able to mentor transplant candidates, for example, or a way to pay tribute to donors, or increase general public awareness about the importance of organ donation. Creative writing workshops were also seen as a form of peer support groups in that way, in the sense that it provided a space for social and emotional support, and was also a way to bring about a desired social or personal change, which is quite profound if you think about it. But most telling is to go at the source. So I selected some quotes from the participants to better illustrate these ideas. Here's one by a kidney transplant candidate. I'll read out to you. So there were moments of frustration, moments of anger, moments of confusion, moments when you can't quite grasp that you are at a point in life when you have reached a situation that you cannot control, but which is well and truly there. So this is about significant moments pre-workshop, and it tells us a bit about here the intensity of emotions that can come with the journey of transplant and donation. This loss of control, uncertainty, and yet the irremediable aspect of it. So here we've got something to work with artistically, and perhaps it can do us some good. So here's the trick and the key element. Interestingly, this ungraspable aspect of the experience is what literary or artistic forms are particularly good at doing or recuperating as a form of experience. And also, one point to make here is that this loss of control that's been reported in our participants about the actual experience of the transplant is somewhat, to a lesser degree, paralleled, and the experience of trying a writing workshop itself, which as an activity was new, or let's say as a way of expression was new to most participants. So required some open-mindedness to discover these new ways of expression. Another quote here I wanted to show you is moving on the impacts of the workshops themselves. So here's from a female kidney transplant recipient. So personally, it did me a great deal of good. It was so cathartic. I'm not the only one to say this. I think others have also said it, but it enabled me to properly understand what I have been through, and afterwards, I can continue going forward with that knowledge. So I invite us to think here, and what is that good that was done? What is that type of knowledge or proper understanding that this person gained? Was it experiential? Was it effective? And how is it different from the knowledge that is traditionally offered or conveyed in standard medical care or, best practices in transplant care? So this ability to continue and carry on, despite the known, emotional distress, uncertainty, what's reported in literature in kidney transplant is also this guilt for the deceased donor at times, anxiety, depression, and name it, all these difficulties. It's interesting that the creative writing workshops offered a way to maybe not resolve concretely these aspects of these people's realities, but offer them a way to better tolerate it going forward. And finally, I wanted to show you that one on the therapeutic aspect of their workshops. So from a kidney transplant recipient, basically, it's really a space that allows me to, I wouldn't call it therapy because that's cliche, but all the same, it's a space for resolving problems in quite an articulate way, a literary way, an artistic way. So that mysterious way is what is created, the confluence of these methods, literary, artistic, peer mentoring, sharing of self-narratives, lived experiences, also the group effect factors, which we didn't even explore in this article, but just the mere fact of being a group and thinking about what happens between people in that context is very interesting. But that certainly played a role as well. So this is this hybrid kind of creation that these creative writing workshops were. And in order to better understand it, a little bit at least, that's where I'm grateful we have Paul and André here to show us their way, or at least how they saw it. So that's the segue into the second part of the presentation. And we'll start with Paul first to break the ice. So in our chair, Paul is well known, I think we can say almost as an emeritus speaker. He's been presenting on several occasions for conferences, and he has a role in patient partner projects. So for our audience, Paul, if you could start just by telling us a little bit about your experience and then about your artwork. And if you could explain a bit the creative process behind it, and then André will join you after.
Will I read my my piece before André speaks, or how do you want to organize it? Do you want comments and we finish up with the reading, or can I read right away? Or
That's a good point. If you want to talk about your experience first, and then if it's related to your piece of poetry, I think it would be better to kind of do that together. But if it's not so much related, then we could reserve the poetic work for the very end.
We could reserve it maybe because
Yeah.
It was done during one of the workshops, but it talks about how I got kicked out of childhood. So it's not directly related to the transplantation.
Mhm.
One interesting aspect of the workshops is that there was never a therapeutic objective to the each of the workshops, and the members were absolutely free to use any to go in any direction they wished, except on a few occasions where the prompts were more directed. For instance, the very first workshop was on the concept of giving, donation, and people could go in any which direction they wanted. Eventually, everyone talked about their transplantation process. But surprisingly, very often, once they've done that, well, where do we go now? It's going beyond what's expected, the cliche. The gift of life, transplantation is essentially that. Now, that's a slogan that's pretty powerful. So how can you elaborate creatively around that? And we soon found out that people were addressing life and death questions. How transplantation was part of that. And for instance, one woman who was a child during the war in France talked about some childhood experience that everyone in the room, well, on the Zoom session was really, really very emotional after her presentation because it was so strong. It has nothing to do with the transplantation, but it was a forum in which her childhood trauma was accepted as is. Another person eventually, and we went to the spring of 2023, with the theme of scars. And we know that the wounds are not necessarily in line with where the scars are. And this person talked about her lifestyle and condition that made her in such a situation physically that she needed a transplant. Now, we're something else. If you want to talk about therapy, well, there's a therapeutic effect, but not a therapeutic intent. And that's very, very important. And tomorrow morning, actually, I'll be doing the same text that I'll be reading tonight in French to a group of students in geriatrics in Montreal. And I'm losing my thought. And the point is to forget a bit about the medical intent and address the people that they're dealing with. And for instance, if a patient tells a doctor, "Oh, thank you, doctor, you saved my life." Well, please, doctor, do not respond. I'm just doing my job. Say thank you. And I'm pleased, I'm glad, and move on. So that's the general context that we were involved in. And I'll stop there for now. André, it's all yours.
Okay. What I can share about my experience was that, well, of course, the situation my wife was going through, she was on dialysis for 2 years after having contracted Wegener disease. And that was very painful, of course, for her, but also for me as her spouse, life companion. And after the transplantation, given the opportunity to participate in writing workshops, creative writing workshops, I felt that perhaps I could leave something in writing to my children and grandchildren, just a little something that they could read, and I could share my experience with them a little bit on what we went through and what are the important things, aspects that I would like to convey to them. So I was focused at the beginning with sharing an experience. And slowly, that there was a transformation in myself concerning what was I doing here. And what happened is I started asking myself, well, what can I learn rather than what can I express or what can I inform people about? And I started listening to what emerged more than try to formulate thoughts and feelings as I had first thought what I was trying to do. And that's changed the perspective completely, because on the first evening of our workshops, there was always a specialist who prompted us with content and with a mode of expression, a form, let's say poetry or drama or short story or others, and also many times a theme. And if I simply sat the next morning after breakfast or during breakfast with a piece of paper and a pencil, I simply let emerge elements of my of where I was at that time. So this is the next morning after the workshop, where the idea of the workshop was conveyed, and I sort of discovered so many beautiful things about about myself and about the process and about the living experience, the life experience we had been through, my wife and I. One other element I wish to express is that the group's influence that was referred to before was very important for me, because many people went in quite different directions in what they were expressing from month to month, and it brought me to explore avenues that perhaps I would have neglected or would not have looked into. I think Paul is an example of someone who opened windows for me, and the actual experimentation I went through was to let myself go and write what emerged, and the themes proposed always touched a little fiber in me, and something got written up. I'll give Paul the opportunity maybe now to express his poem or his piece of writing, and then maybe I can express mine. But maybe just let me conclude with it did benefit me a lot. There was an existential benefit, I would call it. I felt free, I felt loose, and I let the pains and the sufferings rise. And I also let the beauty of the miracle, if you wish, of my life companion being well again. So all of this emerged in different artistic forms, and mind you, I'm an amateur writer, perhaps a little bit awkward most of the times, but anyway, I'm having fun writing stuff. and letting things come up and trying to rearrange them a little bit afterwards. So back to you, Paul.
Thank you. Let me see. Oh, my lighting is not too good. One thing that has to be said is that although the participants were not professional writers by any stretch of the imagination, but there was a pretty literate group. So the products that came out were very legible from the start and organized. So that has to be said, because if there are attempts to have such workshops on a very broad scale, well, maybe that could be some barriers to that. In terms of context of my poem, it was written in the after a workshop given by Dr. Vanessa Yunzi, who's a psychiatrist and a poet, and on the theme of childhood. Now, I've been in the medical system since age 8 with severe juvenile arthritis, and the poem is basically I put it around 13, 14 years old, and it's a story of a coming of age kind of thing. So here goes. Let me grab sit before. Today I was kicked out of childhood. Why? Why? Why me? Early June, locked up in the pediatric ward, hardly standing, my friends out at the park on the streets playing. Why? Why? Why me? Because that's how it's supposed to be, says my little inner voice. Why don't you say you're fucking mad, angry at your price, angry at your life? Terry nights, it's not fair. Toss and turn. 203 tiles on the ceiling. Joints crumbling. Bone rubbing on bone. Pain. Pain, sign of life. Pulsating pain, in rhythm with my heart. Throbbing pain, taking my breath away. Dull, deep, heavy pain, even when I smile. I am witness to the metamorphosis of my hands. Swan neck drifts and buttonholes, boutonnieres even. Middle finger is one hell of a trigger. Sublime subluxations. Asclepius is a poet. Medical imagery. My anger erupts one early morning at summer's end. Doctor, doctor, why am I still here? I want to go home. I'm tired. It's not fair. Do something. Listen to me, my son. He soon called me his son. My father had died, his son gone astray. He wanted to be father knows best. He followed what I did in school, if I learned well. Listen to me, my boy. I'm just a doctor. I don't do miracles. No, but look at me. Do I look like St. Joseph? You want to go home? There's only one way. Pick yourself up and I'll help you. I swallow my pride. I feel I want to control my life. But there's still the nagging. Why? Why? Why me? And why the hell not? Said the little voice. That's how it is. Get used to it. You only get one stab at life. So step by step, standing and walking again, I started to see beauty around me. One of those days of renewal, I saw Denise, her pale blue nurse's AIDS veil floating behind her, walking proud. She entered my room, looked at me, smiling. Well, I think you have acne. Her eyes kicked me out of childhood.
Okay, I guess it's time maybe for questions to Paul.
André, you didn't share your text?
Would you like me to do it right now? Or
Of course.
okay, sure, of course. It's a pleasure. The theme was that we were proposed to write about was a caring look on the scars of our bodies. So that's where I started from for this one. Ode on two scars. Bloodstain on hardened white snow. A look of fright, then appeased. Combat, respite, combat, respite. That was 7 years ago. On
Hello, I don't know if Andre can hear us. Maybe we'll just give it a couple seconds. I'll message Andre in the chat as well. Oh, Andre, you're back. We lost you partway through your reading. I'm not sure if you noticed. Your voice and the video and your voice cut out partway through what you were reading. So we missed it. Would you mind reading it again? I'm so sorry.
Okay, sure. Okay, so that was a practice for me.
Yeah.
Okay, so yeah, you sure about that? No one saw it or heard it. Okay, there we go. First time. Ode on two scars. Bloodstain on hardened white snow. A look of fright, then appeased. Combat, respite. Combat, respite. That was 7 years ago, on ugly winter days. Then they both aged 1,000 years, with wrinkles. On the menu this morning, cuts and then a handful of thanks. Hard river of life, sweet river too. This was 5 years ago, on a beautiful summer day. Then they both aged 10,000 years, without wrinkles this time, or so little. As if through the stained glass window of an ancient village church, a golden light, invisible and yet, seeps onto the path of our lovers, then discreetly onto the paths of their loves. That's it.
Thank you so much to both of you. Laurence, did you want to say some words to wrap up, or do we want to move on to the Q&A?
Yeah, I think at this point, we'd be like excited to hear if you have any questions, and we can take it from there, more conversation style.
Yeah. Perfect. And I just want to say thank you so much to all three of you. I think a big thing I take away from this was this theme of kind of unexpected things that have come up, unexpected things that came up for the participants in general that you were talking about through your research findings, Laurence, but also for you, Paul, and for André. And with that, I will open the floor. If anyone wants to ask a question, you're welcome to raise your hand, and then you can unmute to ask it. Or if you're more comfortable, you can also type your question into the chat and I can read it out loud. I would also like to quickly say a double thank you to Paul and Andre, not only for sharing your poetry, but also translating it yourselves into English for us. Thank you so much.